Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Understanding impetigo is important because it is a skin infection that is very common, especially in young children. The infection causes sores on the skin that can be itchy and sometimes painful. While impetigo is contagious, it is usually not serious. This condition is caused by bacteria that can get into the skin through cuts, scrapes, or insect bites. Also, the infection can spread through contact with someone who has impetigo. Impetigo is most common in children between the ages of 2 and 5, and it is more prevalent in warm, humid weather. Good hygiene practices are very important for preventing the spread of impetigo. Impetigo is caused by bacteria that live on our skin. These bacteria are usually harmless and are a natural part of our skin's ecosystem. The most common bacteria responsible for impetigo are called Staphylococcus aureus and Streptococcus pyogenes. They are often found on the skin and in the nose of healthy individuals. Usually these bacteria don't cause any problems. Our skin acts as a barrier, preventing them from entering our bodies and causing infections. However, if they get into the skin through a cut, scrape, or insect bite, they can cause an infection. This is when impetigo can develop, leading to sores and blisters. Certain factors can make you more likely to get impetigo. For instance, living in crowded conditions or having poor hygiene can increase your risk. Having close contact with someone who has impetigo is a significant risk factor. The bacteria can easily spread from person to person through direct contact. Children are more likely to get impetigo because their immune systems are still developing. They are also more prone to cuts and scrapes while playing. Warm and humid weather can increase the risk of impetigo since bacteria thrive in these conditions. This is why impetigo is more common in tropical and subtropical regions. Certain skin conditions, like eczema, can also increase your risk. Eczema can break the skin barrier, making it easier for bacteria to enter and cause infections. Finally, having a weakened immune system makes you more susceptible to infections like impetigo. This can be due to medical conditions or medications that suppress the immune system. Impetigo usually appears as red sores on the skin. These sores are often itchy and may be filled with fluid. They can appear anywhere on the body, but they are most common on the face, around the nose and mouth. There are two main types of impetigo, non-bullous and bullous. Non-bullous impetigo is the most common type. It causes small red sores that quickly rupture and form honey-colored crusts. Bullous impetigo causes larger, fluid-filled blisters. The sores from impetigo are usually not painful, but they can be itchy. Sometimes the sores can spread to other parts of the body. If you notice any of these symptoms, it's important to see a doctor for diagnosis and treatment. Diagnosing impetigo is usually straightforward. The doctor will start by asking about the symptoms and how long they have been present. A doctor can often diagnose it simply by looking at the sores. They will check for the characteristic honey-colored crusts that are typical of impetigo. In some cases, the doctor may take a sample of the fluid from a sore to test for bacteria. This is especially important if the sores are not responding to initial treatment. This helps confirm the diagnosis and ensures that the correct type of antibiotic is used. Treatment for impetigo usually involves antibiotics. These can be very effective in clearing up the infection quickly. Antibiotics can be applied directly to the sores as a cream or ointment. This method is often used for mild cases. For more severe cases, oral antibiotics may be prescribed. These are taken by mouth and work throughout the body. It's important to complete the full course of antibiotics, even if the sores start to clear up. Stopping treatment early can lead to a recurrence of the infection. While treating impetigo, it's crucial to keep the affected areas clean. This helps prevent the spread of the infection to other parts of the body or to other people. Gently wash the sores with soap and water twice a day. This can help remove crusts and reduce the risk of spreading the bacteria. Avoid scratching or picking at the sores, as this can spread the infection. Keeping nails short and clean can help prevent this. Keep your child home from school or daycare until they are no longer contagious, usually 24 hours after starting antibiotics. This helps prevent the infection from spreading to other children. Preventing impetigo is all about good hygiene. It's essential to instill these habits early on to ensure they become second nature. Teach children to wash their hands frequently with soap and water. Make it a fun and engaging activity so they look forward to it. This is especially important after using the bathroom, playing outside, and before eating. Consistent hand washing can drastically reduce the risk of infections. Keep their fingernails short and clean to prevent scratching. This minimizes the chances of bacteria entering through broken skin. If your child has a cut, scrape, or insect bite, clean it immediately with soap and water. Prompt cleaning helps prevent infections from developing. Cover the wound with a bandage to prevent bacteria from entering. This simple step can make a big difference in healing. Avoid sharing personal items like towels, washcloths, and clothing. Personal hygiene items should be kept separate to avoid cross-contamination. If someone in your household has impetigo, wash their bedding, towels, and clothing in hot water. Hot water helps kill bacteria and prevent its spread. Disinfect frequently touched surfaces to prevent the spread of bacteria. Regular cleaning of these areas is crucial in maintaining a healthy environment. By following these simple hygiene practices, you can significantly reduce the risk of impetigo. Good hygiene is a powerful tool in keeping your family healthy and safe. UMCC, your ultimate medical consultant connectors.